Welcome to Voices Against Violence, a Harmony House podcast to educate, empower, and serve as a voice for survivors. We aim to shed light on crucial issues surrounding domestic violence, offer support, and inspire action for change. Join us as we work together to create a community where all individuals can live a life free of abuse.
Welcome back to Voices Against Violence. My name is Kirstyn. I'm the Assistant Executive Director at Harmony House.
I'm Charity, and I'm the Prevention Program Manager for Harmony House. And joining us today is Dawn Day, and I'll let her introduce herself in a second. I'm so excited to have you on the podcast. Finally, Dawn.
Well, thank you. It's an absolute pleasure to be able to have these conversations and let individuals in the community understand what we can provide for them, because I'm the Forensic Program Coordinator at Mercy Hospital. So that means that I take care of victims of sexual assault and any other type of violent crime against persons. And I kind of oversee and ensure that that care is consistent across our hospital settings.
Okay, I want to know more. How long have you done that? And how did you decide to do that? Because before this role, like you were in working with patients, doing the exams. You're a SANE nurse.
Mm-hmm. Yeah. So about 15 years ago, I've been at the hospital for 19 years. But when we first started, it was any nurse that was working that got told to do it or volunteered to do it took care of victims. And there was no real significant process. We were able to create a formal sexual assault program 15 years ago. So 15 years ago, we created the full-time program. So I really dove into it at that point because I was already one of those nurses taking care of those patients. And the fact that it became official and organized, I went to additional training. So I ended up taking the training twice because I wanted to really specialize and do a good job. Throughout that time, I became the coordinator of the program, and it has flourished and grown into this concept that I now have a full-time position, being able to focus on the care of victims in our community.
Before we get too far into this conversation, I do want to give you a chance to talk about, briefly plug the other work that you do outside of...
Thank you. Like I said, caring for victims as a whole. We don't know when a victim comes into our hospital, like what occurred to them. Mm-hmm. And so much of victimization overlaps with one another. Like I can take care of a domestic violence situation that has been sexually assaulted. Mm-hmm. I can care for an individual who's been sexually assaulted, and I discover based on how the crime occurred, it's human trafficking. Mm-hmm. I have a really huge passion on human trafficking because I think that there's a sensationalized concept to what that is, and really spreading the word and creating education, especially within hospital settings, so that nurses can identify potential victims of trafficking and understand what that looks like in our community, what that looks like in rural Missouri, because it does happen here, and being able to provide them the resources.
And that organization is...
Yeah, and I volunteer for Stand Against Trafficking. Stand Against Trafficking is a volunteer coalition here in the Ozarks, and our passion is to create that education, and through that education, we hope to be able to create the prevention that is required within this community.
Well, we're for sure going to have you back on to talk about that other totally full passion of yours, because that is so interesting, and I definitely want to learn more. This is a audio podcast. Nobody can see us, but we look phenomenal today. We are all in denim because today is Denim Day as a part of Sexual Assault Awareness Month. So I wonder, do you want to talk at all about Sexual Assault Awareness Month, Denim Day, what that means for you in your field?
Yeah, thank you. We want to bring awareness to these individuals throughout the entire year, but April is Sexual Assault Awareness Month, and we create campaigns and more education opportunities and information that we put out there to focus more on the concept of what we're trying to do to prevent this crime from occurring. And then Denim Day is always the last week in April during Sexual Assault Awareness Month. And what Denim Day is it was originated from a 1992, a Supreme Court case. There was a rape case in Italy where the rapist was convicted and actually went to jail, but it was overturned in the Supreme Court because they stated that the victim was wearing very tight jeans, and that led the claim that she would have had to assist the rapist to remove them, implying consent because the jeans were too tight. There was outrage within the Italian parliament. Italian parliament women started showing up to work in denim, and that sparked an international attention, and it created Denim Day in 1999 by Peace Over Violence.
Wow.
And the tenets of that, of the implied consent, we still hear that myth today, right? Like, I mean, do you experience, I know that when we go out in the community, we hear things that are victim blaming, and we still hear those myths. And so I'm curious, do you experience myths around sexual violence and victim blaming, particularly around what folks are wearing?
Yeah, very much. Not only specifically what victims are wearing or what they said or how they acted, or did they have a drink? What did they kiss the person first? That's okay. This concept of something occurring with the victim and that caused the assault to occur.
Right.
Nothing causes an assault to occur other than the assaulter to choose to commit a crime.
Correct.
There's nothing that says, oh, well, yeah, she shouldn't have drank so much. Or, well, she kissed him first. Or, yeah, she wore a really short skirt. And we need to, and also let's bust the myth of the concept that men are sexually assaulted as well.
Of course.
Yeah, 1 in 4 men will have a concept of some type of sexual violence occurring to them in their lifetime. So men can be assaulted as well. And that's a huge myth that we have to bust, is we tend to say she,
right.
But anyone can be assaulted at any point. It's
such a good point.
Yeah, it's hard to explain, right? Because I don't know how to explain how an assailant would decide to do the horrific things that they want to do. But yeah, there is no rhyme or reason to their choice, I would assume, and there is nothing. I think I saw a diagram once that said what percentages can play into rape, and 100% of things that play into rape is the rapist
choosing to assault somebody.
Yeah,
right. Exactly.
There's nothing else, and it doesn't matter if it started off consensual. At the moment you say, "I don't want to do this," right. I'm done.
Right.
I don't want to go any further. Please stop. At any moment, in anything, at any point, even if you're on a date and things are going well, the moment you say stop and that person continues, that creates the crime.
Absolutely. It's so important that we have conversation and education around clear, coherent, willing, ongoing consent, because at any point that something is not clear, coherent, willing, ongoing, it's not consent.
Correct. And we need to get away from the concept of no is no, and move more towards yes is yes.
Yeah.
Because sometimes there's a situation in which an individual's maybe had too much to drink. That is not a golden ticket to be like, well, they can't say no, so I can do this. Yes is the thing that has to occur,
right?
With consent.
Clear, coherent, enthusiastic yes. Anything else is a no.
Correct. And you can say yes and then change it to no.
That's right.
Yeah. And at that point,
yeah,
no is no. But yeah, you have to have the yes.
You can say yes to one particular activity, and that is not a pass to all activity. Correct. Right?
Correct. Not enough. We don't talk about consent enough, and people don't understand that. So I think we need to bring Dawn back for 2 more episodes. Back for just a whole episode about consent. I wonder if while we're talking about this, because there's that idea, and I've heard people say this, and I'm sure you have too. Well, why didn't she say no? Why didn't she fight back?
Let's make it a 4th podcast. Yeah. Let's talk about trauma on the brain. Yeah. Your brain is built to react in a certain way when trauma occurs in a situation. Your brain triggers with trauma. Your brain decides, this is how I'm going to choose. And we talk about fight or flight, but honestly, the majority of my patients choose freeze. And they will say to me, I always thought I would fight back. I always thought I would kick and yell. I took self-defense classes. I really thought that I would never let this happen. And we have the conversations of, you didn't make the choice not to fight. Your brain chose freeze for you.
Right.
It's a survival mechanism that your brain chooses. And often in traumatic acute situations, as it's occurring, people freeze. And I have people looking back saying, I should have fought back, but I just couldn't. And they often have self-blaming concepts of like, it's my fault. I didn't fight back. No. Your brain protected you in that moment. Your brain chose that path for you, and you didn't choose to freeze. That's one component of it. But the other is there are individuals that just say, I tried, but he started to hurt me. He started to threaten me. He was on top of me, and he was way bigger than what I was. Anything I did just made him mad. couldn't get out. I couldn't get away. And a lot of victims feel the concept that they just want to give up during the time of attempting to fight because they feel like it's going to make it worse. They're going to get more mad. They're going to get aggressive. They're going to get physical.
They're trying to survive in that moment.
Right.
So, yeah, and I think within a lot of crimes, individuals, they just choose to say, okay, me fighting is not going to help the situation. If I just sit here and I just don't do anything, it'll be over soon and I can get through this because they feel as if there's no worth to fight because they see a sense of not being able to get away from the situation.
Yeah, the freeze response. I think that that's such a powerful thing to remind folks of. And I love the language that you're using of your brain did what it had to do to keep you alive, right? And like the term for it is tonic immobility, right? And we see it happen in like the animal kingdom as well, as like animals will freeze when there is like a threat. But it's literally your body reacting on your behalf. And there's so much shame and blame involved when somebody thinks that maybe they would have fought or they would have fled, right? But then their body chooses freeze. And so I can really see the value of having a trained SANE talking that through with them and having somebody in the room who understands those dynamics. So can you tell us more about the role of a SANE? Like, what does that job look like? What's the training for it look like?
And let's start by telling everyone what SANE stands for.
What is that? What is a SANE?
Sure. SANE is an acronym for a sexual assault nurse examiner. Being a SANE nurse, you have to be a registered nurse to be able to be a SANE nurse, and we want you to have 2 years of experience nursing. This is a tough job. This is a specialized job, and there's much knowledge and experience and emotional regulation that occurs with this position. So we want you to be experienced, usually about 2 years. And then everyone's like, well, how do I know? And I'm like, if an individual who has been a nurse and has been working has the passion to want to do this, we can train them. Because passion and having the wanting to care for people and wanting to do right for individuals, that cannot be taught.
Right.
So if you have that passion and you have that want, then we can train you. So pretty much across the board in the United States, you have to go through an accredited 40-hour course. That 40-hour course is didactic learning, and then you have to have skills sessions and within SANE programs that are built with a component of like maintaining their nurses and not having tried to have turnover. I really focus on a mentor concept after they've been trained, because SANE nurses are the highest turnover in any healthcare. Like, right, you have certain areas that they're like, well, ER has high turnover and like psych department has high turnover. Unfortunately, I end up losing SANE nurses before they ever complete their training.
Wow.
It's hard. I will tell them, this is going to be the hardest job you've ever done, but it's also going to be the most rewarding position that you've ever held, because you can actually make an impact on someone. One thing you say, one way you say it, one smile, one hug, one caring touch, that can mean the world to an individual. That could change their perspective on the next steps that they would need to take in this journey of fighting against, let's take that word away, fighting. I hate it because that's another myth. Individuals think that they have to fight to prove themselves right. They feel like they have to fight for people to believe them. We need to stop doing that. They shouldn't have to prove themselves.
The responsibility is on us to believe. Just start with believing.
That's a big thing that the community needs to realize is that we need to start with believing. Believing what they say, because it's not their responsibility to prove to anyone that something bad happened. We need to believe them, because I hear people all the time say, well, the girls lie, they make it up. Really, statistically, only 2 to 10% of individuals like across the world make false reports.
Right.
They're not going forth and lying. They wouldn't want to go through this concept of what is necessary when you say you've been a victim of sexual assault and go to the hospital. So start by believing, and that's what I instill in my SANE nurses. Whatever they say is the absolute truth. And some of the things we hear are hard. The job is hard. So yeah, creating that mentor program. So in my world, you don't become a SANE nurse and say, checked a box, done. I'm a SANE forever. We need to create that ongoing education, that ongoing training, that ongoing mentorship to be able to continuously care for these victims.
What does it look like when someone comes to the hospital because they've experienced something?
Yeah, and that's it can look different between hospital settings, but generally, when you come in and you report that you've been sexually assaulted, we want to take you in an area of privacy. Obviously, we need to talk to you a little more, and we don't want to do that at the triage desk when you walk in. There's people standing around you. And then there's sometimes, and each hospital has their own protocol, but usually someone that has experience to ask these questions will initially say, what is it that you're needing today? What can we do for you? Because first, obviously, if you're coming to a hospital, we have to rule out any emergent medical concerns. Are they bleeding? Are they breathing? Do they have like an obvious broken arm? We have to attend to that first before we can go into any form of forensics. But if they come through and they're medically stable at that moment, then we ask them, are you here to get a sexual assault kit collected? That typically, like I said, there's some variations across the nation, but typically we collect evidence up to 120 hours post an assault. That's 5 days post an assault. We will collect evidence because there's statistics that show that DNA can live in the vaginal canal up to 120 hours post an assault.
Wait a minute. What?
Yeah. So that's...
Did you know that,
I did know that.
But
I also used to work at a rape crisis center, so I had to know that.
Yeah. So that's... Yeah, I feel
like this is important information because sometimes people think, well, it's already been a day or a couple of days, but up to 5 days.
Yeah, and please don't think, obviously, from a SANE's perspective, we would like you to come right away.
Yeah.
Because every moment is a chance for us to lose evidence. But please don't think, well, I didn't know what to do at first. I went home and I showered and I changed my clothes, so there's no point. No, please come in. DNA lives in areas on the body that SANEs are experienced to try to go find, like the vaginal canal. And DNA can live, like scientifically wise, it can live in that environment up to 120 hours. And that's where we base our reasoning off of being able to do it up to that point.
Right.
But please don't think that there's any determinants in between of like, oh, well, I did this on day 2, I did this on day 4. It's not worth it. At any point when you're ready, and please know that we will do it up to that time. But yeah, in some facilities, you have the option to see a physician or not. That's not consistent in every hospital. But if you're coming for forensics only, some facilities offer a physician and encourage a physician to see you, but you don't necessarily have to, in some hospitals, see a physician if you're only coming solely for forensic care. And what that is, you will be greeted by a sexual assault nurse examiner who's been specially trained to provide this care. And then what we do is we offer prophylactic medications. So we can offer prophylactic medications for STDs, HIV, emergency contraception. We discuss reporting options. This is going to vary across the state because it's going to be what's available in your region, what your law enforcement's able to do. But there are options of a reported sexual assault, an unreported sexual assault, and an anonymous sexual assault reporting system, and that's something that will be explained to you by the SANE nurses. You do have options on what steps you want to take next. I tell my patients, you are in charge in this room. You make the decisions, you choose the next steps. I'm here to educate you and give you options. But whatever you say we will and won't do, we will and will not do. And then we bring advocates in the room, family and friends, whatever support person or advocate or individual they feel comfortable with. We create a comfortable environment in the best sense that we can, because then we have to go through an interview based on the interview, and we just ask them, tell me what happened, and we'll ask questions based on what we hear from what physically occurred. Then we collect the physical evidence. So we do so based on where we heard that they were touched or licked or wiped or whatever. I mean, we ask unfortunately, a lot of questions, and then we collect evidence. So that can include fingernail swabs, hair samples, any swabs across the entire body where we think there could be potential of DNA. We do genital exams and we collect clothing. We can also collect blood and urine if there's drugs or alcohol involved. So everything we collect is based on what the story is. But we are really there as an advocate. We give them follow-up resources. We are blessed to have the follow-up resources that we have within this community, and we provide those follow-up resources for them. And then something else that's important to know, we do not charge for evidence collection.
Okay.
No hospital in the state of Missouri is allowed to charge evidence.
Wow.
So medical care is kind of part of that. But yeah, if you go and say, I am a victim of a crime, I want evidence collected off of my body. I think this assailant's DNA is on me.
Yeah.
There's not a charge to perform that care in a hospital to collect forensic evidence.
So many thoughts coming to mind. One is just thank you for the amount of choice that you just described. You're in charge. You get to make your decisions here. I just imagine that would be very powerful to somebody who has just experienced no choice in what occurred and what happened to them. So just thank you for bringing choice into that conversation. I'm curious, and you don't have to have a specific number or statistic on this. What is the general? I mean, does every hospital have a SANE? I mean, are you few and far between? Like, what are we looking at across the country?
Well, wait, like how many are there here in Greene County? And then
tell me national trend. Like, is this?
Ooh, yeah.
If you can, if you're in an area at a hospital
that doesn't, because
I assume there's not one at every.
Correct.
Right.
And I can specifically speak to the state of Missouri.
Yeah.
There's been some legislature that has passed that has supported victims and the options in the care that victims are able to have access to. So currently, as of now, in the state of Missouri, every single hospital should be able to provide you that care. So what that means is there's either a sexual assault nurse examiner within that facility or a sexual assault nurse examiner on call.
Sure.
They can come in. Or there's a process called SANE. So we don't want anyone to be turned away. So what that is you will have a staff nurse at your side that is caring for you, and they will use virtual SANE that is very confidential. Like the state went through so many IT checks on this. It's extremely confidential, but you will be speaking to a trained SANE nurse on the other end. Now, please know that this nurse within the hospital setting has had training. They understand the basics of evidence collection and how to care for a victim. But the SANE nurse on the other end on the computer will really go into the specifics about what options you have and really help answer those specific forensic questions. So that is set up across the state of Missouri. I will tell you, I cannot 1,000% say, yes, every hospital is exactly like that right now. But yeah, this went into effect in 2026.
Wow.
So there may be some outlying
Wait, this year?
Yeah. So
Better late than never.
the law passed a while ago, but the problem is that the verbiage within the law stated, yes, this is what we want to do. But we had to create the resources. So we had to create training for SANE nurses. And when I say we, the state of Missouri, had to create training for SANE nurses. We had to purchase the technology. They had to get the technology in the hospitals that chose to utilize the process called SANE. And they had to create designated appointed hospitals to be those point sites that are the leaders in this technology and are the ones on the other side of the phone. We had to come up with statewide protocols. And of course, all that being said, there's funding that needs to happen to support all that. So the state worked very hard. And yes, they worked for several years to be able to get this going. And there are teams of people that have worked across the state tirelessly focusing on only this. And I do want to say, this was expected of every hospital years ago because the law was written, it got passed, the verbiage went out there, and it was expected. But as of January 2026, that was everyone in the state now.
The implementation of it.
Now,
sure.
This is like you've had time, you've trained. So yes, there have been a lot of hospitals that have started this concept of not transferring victims for several years, especially in our region. Because we don't want rural facilities to have a patient drive or send them an ambulance, or how they're going to get back. And then they're away from where their family and friends are. So a lot of people have been doing it for several years, but I think okay, we're done. Start button officially started for the entire state in January of this year.
Dawn, I am so grateful that our community has you as a resource and just all of the work that you're doing. As we wrap up the conversation today, if there's one thing that listeners could take away from today, if you could share one thing with our community about the work you do or the things that you're passionate about, what would it be?
Believe survivors. If I can give one statement, one word, believe survivors.
Yeah.
Because individuals that have been through trauma, it affects them not only in the short term, but in the long term as well. It can affect them mentally. It can affect them physically. There's increased concerns for like drug use or difficulty in social settings. Everyone is going to experience trauma in their own manner, and we're going to see this long after an individual has been victimized. So within the community, support those survivors and believe them. What they went through is their story, and we need to believe their story, and support them. Like I said, we have fantastic organizations in this town. Right. I'm sitting here in one of those organizations in Harmony House. I'm very blessed to work in this community because there are so many resources that care for victims and want to support them. But what I need the community to do is I need you to support those agencies that support the victims. Because unfortunately, the instance of victims is unfortunately skyrocketing, and these agencies are doing their best. But yeah, do they have enough spots to take in people? Do they have enough therapy sessions to be able to provide? Unfortunately, victims have to wait sometimes to receive these resources. So yeah, your job, number one, believe survivors. Number two, support those agencies that are in the work to help survivors to continue to be called a survivor for the rest of their life.
Right. Thank you for that one piece, that one lasting bit of knowledge, knowing that we're going to have you back 4 more times. I think we decided in this podcast.
We'll just block out a whole afternoon. Dawn, I just don't even know what to say. Personally, this is like one of the best, I think, conversations that I've had with a guest on the podcast. I knew you were a fierce advocate, but you are just an incredible powerhouse. And the community is really fortunate to have you here doing the work that you do. So thank you. And look for that email coming to schedule you. And we'll talk about more things. Thank you so much, Dawn.
Thank you so much for this opportunity to be able to get this information out to individuals that hopefully we can help in the future.
All individuals have a right to a life free of abuse. If you or someone you know needs help, please call our 24-hour hotline, 417-864-SAFE, 417-864-7233, or chat 24/7 with an advocate on our website at myharmonyhouse.org. Visit our website or follow us on our socials to stay up on the latest news and events. This is Voices Against Violence. Thanks for listening.